The new variant of COVID-19, Delta, has been accounted for at least 93% of all cases reported since last month. All right, y'all, in some parts of the country with low vaccination rates, the percentages are higher in the Black, Indigenous, people of color community. Some barriers contribute to lower vaccination rates. Now, health experts have described this latest stage of COVID-19 as the pandemic of the unvaccinated. Now, according to the latest HIT strategy survey, a Black people survey, only 48% say they will get vaccinated, while 52% say they will not. Black and Latino Americans are the groups most at risk for the coronavirus and are the least vaccinated compared to their white counterparts. How will the reimposed mask mandate and require proof of vaccination stop the spread of the Delta variant? Well, joining us now is Terrance Woodbury. He is the founding partner of HIT Strategies. Terrance, glad to have you back on Roland Martin Unfiltered. So 52% of Black folks surveyed say they're not going to take the vaccine. But what's happening right now, Terrance, is you're seeing an increasing number of companies that are saying, your ass ain't vaccinated, you can't come into the office. You can't keep working.
Yeah, that's exactly right, Roland. You know, people of color face real and perceived barriers to this vaccine that we have to get serious about overcoming. We've been categorizing or characterizing this vaccine rollout as the largest product launch in the world's history. We are introducing a product that did not exist this time last year, and we need the entire world to adopt it. More importantly, we need the most marginalized communities, the most cynical communities, the communities that do not trust healthcare systems and governments, the communities that are the most at risk. We need those communities to adopt it. And right now they are facing real and perceived barriers, information barriers, access barriers, that we have to start getting very serious about overcoming if we're going to course correct this thing before it gets too late in the fall.
But what does that actually mean? Because part of the problem is you've had these agencies that got all this money and they basically gave it to, let's be clear, white media, Black targeted media, and just threw it all around. Wasn't targeted, wasn't focused, wasn't very clear, and frankly, a whole lot went to waste. And now they're trying to figure out, what's plan B? And I can tell you, as a Black-owned media outlet who put a proposal in, folks did not respond to it. I know other Black media didn't get jacked, and now all of a sudden, a survey like this, well, this is what happens when you don't properly fund the media outlets that know how to communicate to Black people.
That's exactly right. You know, it's the same thing we talked about, you and I talked about last year, Roland. We were going through some of the barriers to voting during the pandemic. When we had to convince people of color that they can trust the vote-by-mail system, the same barriers of information, barriers of a system that they had never used before, barriers of trusting that they would not be harmed in an unfamiliar process. We're facing the exact same barriers, and the way that the Democratic Party and other politicians had to engage with trusted messengers like you. We have to use the same tactics to overcome some of the information and trust barriers here. Look, people of color have real cynicism towards systems. When I sit in focus groups and ask them, why don't you trust this vaccine? Is it the production? Is it the doctors? Look, they're talking about historic injustice. They're talking about Tuskegee. They're talking about Henrietta Lacks. They don't know what's in this syringe. And frankly, seeing someone like Barack Obama or someone like LeBron James get the vaccine does not inspire trust in them. Not because they don't trust Barack Obama and LeBron James, but because they don't trust the system and they think that LeBron and Barack are getting a different syringe than they are.
Well, first of all, LeBron actually has not publicly discussed whether he even got the vaccine.
I mean, he's been on my list of trusted validators and messengers of people that they would trust. And when I asked them, you know, sports figures like LeBron or entertainment figures like Ellen DeGeneres or Oprah or political figures like Barack and Michelle, they say, look, they're getting a different syringe than I am. And that's just how cynical folks are. And this is a valid and real cynicism. And so we do need to engage trusted messengers, Black doctors, Black healthcare providers, Black media, Black education institutions, Black religious institutions, trusted validators that can really talk to the community and start to provide the information that they need.
Well, here's the question: Is the White House and the COVID task force, are they paying attention to this? Is the CDC? Is the Department of Health and Human Services? Are any of these people? Because I can tell you, we've had absolutely no luck with this, and I ain't got no problem saying this here. I got no problem saying this. There is no other black-owned media outlet that has done more segments and that has put on more black doctors and scientists discussing COVID than Roland Martin Unfiltered. We have had more than. Matter of fact, while I'm doing that, y'all let Keenan know. I want to see that. I want to play that spot next where we haven't even updated it of all the different names. So it's probably about 5 minutes. Y'all get that ready. And so we probably had more than 100 segments. And so we've had North Carolina A&T doctors, Meharry doctors, doctors from, black doctors from all across the spectrum, because we knew how this was actually affecting us. And and you're absolutely right. That there's a reason I ain't put black celebrities on discussing COVID. That's right. I ain't trying to hear from nobody black who bounces a basketball or who sings or who tell jokes discussing COVID. What we putting on are black doctors, black scientists, black ER doctors, the National Medical Association. That's what we've been doing.
Folks, back to that Roland Martin Unfiltered video in just 1 moment.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. Hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have, you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com.
Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.